Welcome to the Explainer. So today, we're diving into a major new healthcare policy that's been making headlines everywhere. Now, at first glance, a term like unified health interface might sound, well, a bit dry, maybe even a little bureaucratic. But I promise you, this is a development that's going to fundamentally change how you experience your very next doctor's visit. We're going to take this massive, complex piece of digital infrastructure and break it all down so you can see exactly how it impacts your day-to-day life. But, before we get into the actual policy, let's just talk about the reality we're all living in right now. Have you ever actually tried moving your medical records from one hospital's app to another? It's an absolute nightmare. You've got one app for your dentist, a totally different portal for your primary care doctor, and yet another system entirely for the local hospital. And then, of course, there's the universal joy of sitting in a waiting room, filling out your entire medical history on a paper clipboard for, the fifth time this year? None of these systems talk to each other. It's a completely fragmented medical system, and quite frankly, it places a massive, totally unnecessary burden right squarely on your shoulders when you're just trying to manage your own health. To make sense of how this is all about to change, here's our roadmap for today. First, the healthcare disconnect. Second, introducing the UHI. Third, decoding seamless access. And finally, the future of your health. Okay, let's dive into Section 1, the healthcare disconnect, navigating a fragmented system. To really understand the cure here, we have to understand the disease. Right now, we're dealing with totally siloed hospital applications. Every single provider wants you locked into their specific digital ecosystem. And because these medical record systems are fundamentally incompatible with one another, it leads directly to a huge issue: the frequent loss of your patient history. You walk into a brand new clinic and you're basically a blank slate, having to rattle off your entire medical history from memory. And what does that lead to? Repeated, totally redundant diagnostic tests. You end up paying for and sitting through the exact same blood work or scans just because the new doctor can't seamlessly access your old doctor's files. It creates immense friction for absolutely everyone involved. So to summarize the core issue here, we are stuck in a fragmented system where your personal, highly sensitive health data is basically trapped in isolated silos. And the worst part, the current system makes it your job, the patient's job, to play courier, physically or digitally lugging your health information from one silo to the next. It turns simply managing your health into an exhausting administrative chore. Moving on to Section 2, introducing the UHI. The policy solution. So the big breaking news here is that Minister J.P. Nadda just officially launched the Unified Health Interface. The overarching goal of this entire initiative is to enable seamless access. This is a massive governmental push to basically restructure the digital plumbing of our healthcare system, stepping away from those isolated islands of data we just talked about and moving toward a fully connected national grid. Let's break down some of that bureaucratic jargon, because this definition is going to be our foundation for the rest of the explainer. So, what exactly is the Unified Health Interface? It is a digital public infrastructure enabling seamless, interoperable healthcare access across different applications and providers. Now, interoperable is the magic word here. It means systems that were previously speaking completely different languages are now getting a universal translator, allowing them to instantly and securely share data. And this brilliantly illustrates Minister Nadda's primary stated goal for this launch, which is simply seamless healthcare access. It's not just about, creating another app. It's about building the invisible pathways between all the apps that already exist. It's about removing the friction so that your data flows just as easily as your conversation with your doctor. All right, Section 3, decoding seamless access. How it actually works. It's one thing to announce a high-level policy, but let's see how this translates into practice. Notice the contrast here. On the left, you've got that frustrating paradigm we just discussed: siloed healthcare apps, closed networks, and records isolated to a single hospital. It's kind of like having a phone that can only call people who bought the exact same brand of phone. Crazy, right? But on the right side, you see the UIV vision: an open network, interoperable records, and true cross-provider access. No matter what app you use, and no matter what app your doctor uses, the data can flow securely right between them. If you're still kind of trying to wrap your head around this whole interoperability thing, this analogy should give you that aha moment. Think of the UHI exactly like email.
When you send an email from a Gmail account, you don't even stop to worry if the person receiving it is using Yahoo or Outlook or Apple Mail. The infrastructure of the internet securely routes that message between those completely different providers seamlessly. You don't even think about it. Well, UHI does exactly that, but for your medical records and healthcare services.
Let's actually walk through how this builds into a step-by-step process. Imagine you need to book a teleconsultation and you need to share a recent lab result. Step 1. You pull out your smartphone and request the service using your favorite health app. Let's just call it App A. Step 2. The UHI framework kicks in, acting as that invisible, secure digital bridge, connecting your request and your data. And Step 3. Your doctor, sitting over in their clinic, receives your request and your data, perfectly formatted on their completely different system, App B. The friction is literally completely gone. Which brings us to Section 4. A future of your health. Impact and implications. So the crucial point is, why does this actually matter for you? What should you take away from this? First off, doctors get instant access to a comprehensive patient's history, which means better, safer medical decisions for you. Second, you have the freedom to use whichever app or interface you actually prefer, without getting locked into a hospital's clunky proprietary software. Third, we're looking at a massive reduction in redundant paperwork and those clipboard forms you're always filling out. And finally, it creates a centralized, patient-controlled healthcare journey. You literally hold the keys to your data, allowing it to flow wherever you authorize it to go. You know, it is so important to remember that this isn't just some abstract piece of tech news or a distant government policy. UHI transforms this dry policy into a deeply personal digital public infrastructure. It's literally reshaping the digital vaults that hold your most sensitive health data, putting you right at the center of the network instead of at the very edge of it. But as we wrap up this explainer today, I want to leave you with a question to ponder. We've seen the incredible convenience this brings, for sure, but we always have to look at the other side of the coin. Is a unified digital health system the ultimate cure-all for our healthcare woes? Or does centralizing the pathways for our most sensitive data bring up entirely new challenges when it comes to privacy and cybersecurity? It's a massive technological leap forward, no doubt about it. But how we navigate the privacy aspect is going to be just as important as the technology itself. Thank you so much for joining me on this explainer, and as always, keep asking the big questions.